Hi everyone, we're back with our third video in this series for chapter 10. And so let's just pick up quickly where we left off. Take advantage of your pause and the fact that you can rewatch these videos over and over, fill out your study guides, and then read your chapters and study them so that as we move you'll be getting ready for the next test. So, monitoring blood volume acquired by venipuncture. Okay, and we touched on this in lab class. We touched on this in chapter 11, and we've just touched on it a bit in chapter 10 as well. So remember, a lot of this information that is on this slide is also in your textbook in chapter 10. Okay, so make sure that you're using all the tools at your disposal to make sure that you're able to get all the information you need to fill out your study guides. Because remember, all the information that you need for your test is on your study guides. So always when we're trying to worry about how much blood volume we're acquiring from a patient, the first thing we think of is the smaller the patient, right? Neonatal babies, neonates, pediatrics, patients who are critically ill and are being stuck a lot and having a lot of blood drawn. We really need to be cognitive of the and monitor the volume of blood being collected. Okay, so suggestions for reducing and coordinating blood collection. Okay, coordination of lab requests among all physicians working with the patient to reduce duplicate orders. Speak up if you for 1 second think this is a duplicate order or they're ordering too many of these for whatever. It never hurts to communicate with that nurse to make sure that everything's on the up and up. If something seems odd to you, never feel frightened to respectfully voice your opinion about it. Okay. If you have one of those particularly vulnerable patients, you want to maintain a log of frequency and volume of blood collected on that patient, especially neonatal babies, okay? You always want to make sure that someone is taking care of making sure that you have some organization along with coordination of your lab request, okay? You do want to avoid frequent requests minutes apart, okay? You want to monitor the number of times a patient can be punctured. These are all things that we all need to take the time to keep up with. Okay? So now, continuing on this same vein of trying to monitor the amount of blood volume acquired by venipuncture, you always want to keep up with the number of times in a day a patient is being stuck. You always want to reduce the amount or the volume of blood discarded with using blood from IV lines. Okay? We want to better educate physicians to be aware of all the tests on each panel. Notification of the lab when multiple time tests are ordered. If a hemoglobin is ordered at 2 p.m. and a glucose test at 3 p.m., it may be possible to draw them both at once with permission. This is a classic example of when I said don't be scared to speak your mind respectfully. But it never hurts if you see that you have these tests that could be done, they're only an hour apart and they're not stat or anything like that, like a hemoglobin and a glucose. It never hurts to ask that nurse, say, would it be an issue to either do them both at 3 or both at 2 so that I don't have to stick the patient just an hour apart. Sometimes it was just an error and 2 different people were putting them in, maybe even from 2 different doctors. And you, respectfully talking to the nurse about it, will bring it to their attention and you could fix this problem. We always want to assess stats to make sure they're necessary. We always want to coordinate therapeutic drug monitoring orders and make sure that those are done and that properly. You always want to make sure that you have aware of patient transfers if they're moved from one floor to the next to coordinate test requests from different floors, okay? And remember the slogans, a stick in time, save 9. and let's stick together. Okay? Those are two little slogans that will help you try to remember. A stick in time saves 9. We're going to try to control this volume as much as humanly possible. We do not want to stick these patients too many times. Sorry about the co-workers in the background. So, also moving on to reduction of hematoma complications. And if you look on page 361 in your textbook, you will see another examples of some hematomas, not quite as bad as this one. This is one of the worst I've ever seen. But there's also information, like I said, in your textbook. So we're going to try to see, I know this is difficult, but we're going to try to see if we can get just a little bit better of a shot. I'm working through this to try to find the best way to get this done. Okay, guys? I apologize for that. So methods for reducing the likelihood of a hematoma. Okay, so if you insert the needle in at the correct angle, okay, you want to avoid going all the way through the vein or having the bevel halfway in or out, because that can lead to a hematoma. You always want to remove that tourniquet prior to removing the needle, okay? You know, I'll say this to y'all in lab. What do we do next? What do we do next? No. You know, you've got to remove that tourniquet prior to removing the needle. Use the recommended veins only, okay? And check for hematoma formation during the procedure. You want to make sure you apply pressure for 3 to 5 minutes without letting up. Methods for avoiding specimen hemolysis. And that picture over there to our right is number 1 tube is no hemolysis, 2 is slightly, 3 is moderately, and 4 is grossly hemolyzed. And I'll try to move in, like I said, guys, and see if I can get just a little bit better of a picture there. Again, I apologize for the quality. We're going to improve this as we go along. Okay, so other things we talked about in nauseum. We talked about allowing that alcohol to dry for more than one reason, and hemolysis being one of them. Do not collect blood from a site that already has a hematoma. Make sure when you use the syringe, you attach the needle securely to prevent frothing. And also, remember I had said tight but not too tight? Avoid pulling the plunger back too quickly, and making sure you gently invert your tubes. Do not shake them, okay? Patient refusals. All patients have the right to refuse treatment of any kind. Okay, so if you go in and a patient does not want you to stick them, it could happen. You can explain to the patient that the lab results are used to help the physician make an accurate diagnosis, to establish proper treatment, and to monitor the patient's health status, and that their cooperation would be greatly appreciated. Now, if that patient continues to refuse to have their blood drawn, you want to document that refusal and have the physician notified. Okay, emergency situations that happen during phlebotomy procedures. Now, this is rare, but it does happen. So we want to be prepared for even the rare thing. Preparation is key in most things. In your class studies, if you guys will do the things I'm telling you, if you will read these chapters, if you will fill out your study guides, if you will go over these lectures and these slides and study those listings and all that, you will do well. You will be prepared to take this test. So we need to prepare for something that could possibly happen. Sometimes they react physically to a venipuncture procedure, whether that's feeling nauseous, having convulsions, fainting. If a patient faints, you want to notify first aid personnel. You want to position that patient flat, lowering their head and arms. Ammonia inhalants are no longer recommended. You can open up a little bit of an alcohol prep pad and loosely put it over their under their nose. Loosen any tight clothes they have on around their neck. If a patient feels nauseous, offer them a basin. You'll usually have those in the lab. You can apply cold compresses to both patients that have fainted and to ones who feel sick. And you also want to notify whoever is in your policy and procedure at your particular facility about what was going on. If a patient has convulsions, you want to prevent the patient from injuring themselves further. Okay? Move chairs away from them, move tables away from them so they don't hit themselves. And again, you want to notify whatever first aid personnel immediately that this happens. Now moving on to time test. If a patient is ordered for a collection at a particular time, the healthcare worker should draw the blood as close to that requested time as humanly possible. Some lab values must be based on a specific time because of when a medication was administered, such as digoxin. So we've talked before about time test. There's fasting restrictions that deal with your glucose, your cholesterol, and your triglycerides, or circadian stuff that we take into consideration, having to do with diurnal rhythms and things like your cortisol. Time specimens are also critical for therapeutic drug monitoring. Okay? So results for therapeutic drug monitoring tests are used in establishing a patient's drug dosage. Remember, we always want to give patients enough so that that drug does what it's supposed to do. But we don't want to give them too much to hurt them. Remember how I talked to you guys when we were going over the toxicology chapter, when I talked about that all drugs, if you look on your acetaminophen bottle, your Tylenol bottle, or your ibuprofen bottle, it'll say don't exceed taking this many pills in a 24-hour period. It's because they've ran tests on this and they're aware of what the toxic level could be, and they don't want you to take more than that. That's a lot of times when we're establishing these patients' drug dosage. We want to monitor or confirm any type of overdose. We want to determine if they're getting the right dosage. Is it doing what it's supposed to do? We need to establish a baseline dose after a patient starts a new medication. You want to check for drug interactions, check to see if the drug is affected by a patient's habits, such as smoking, after a change in kidney, liver, or GI function, within 6 hours of a seizure, and on and on. So just remember, it is important to get these tests done at a certain time. Now, we were talking earlier about cortisol. It increases or decreases with the time of day. 8 a.m. is at its highest and 8 p.m. at its lowest. So it's usually drawn at the same time every day. Aldosterone requires the patient to be in a recumbent position for 30 minutes prior to blood collection. Now, I'm going to move this in for y'all. Now, make sure that you understand this stuff. That you know, if you have a question on a test that says which test requires the patient to be recumbent for 30 minutes prior to collection, you're going to need to know that, okay? So just make sure that you're taking a real good look at this and make sure you're reading everything and filling out your study guides, okay? So Renin requires a specimen for a 3-day special low-sodium diet and documentation about whether a patient was upright or supine. For TDMs, the trough sample is drawn right before the patient takes the next dose. So we want to do that time trough specimen to make sure that they don't have too much of that drug lingering in their system before we hang their next drug. And then, usually when the drug is at its lowest concentration, we hope, and that's what we're looking for, to make sure it's at its lowest concentration before we give them their next set. Okay? And the peak samples, which represent the highest drug concentration in the patient's blood, are collected from some IV drugs, such as antibiotics. And what we do is we want to see right after they get it, when it's at its highest concentration, to make sure it's not too high. Or are they getting too much? Everybody's kidneys may not work as well as everybody else's, and they may not be flushing this stuff out as quickly, and we don't want to give them another dose if that dose is too high, or we want to adjust the amount of medicine they're getting depending on what those peak samples are. Lactic acid test must be drawn without a tourniquet, and a lupus erythematosus LE test is drawn in a green tube with beads. So these are all things you'll need to know for your test, okay? Fasting specimens, okay? Fasting specimens require that blood be taken from a patient who has abstained from eating and drinking anything, including black coffee, including smoking, including chewing gum, and even unsweetened beverages such as coffee and tea without sugar in them. The only thing they want is water for a period of time, usually anywhere between 8 and 12 hours, okay? Stat specimens are drawn, delivered to the lab, and analyzed without delay. That's the reason when I talk about turnaround time in stats, we talk about the best choice in tubes. A lot of times that's why we choose our green top tube for a lot of our chemistry profiles and panels, because it does not require any time for it to clot. You can spin it down immediately, which increases your turnaround time. The specimen collection tray should not be placed on the patient's bed or on an eating table. It should be placed on the patient's bedside. And guys, this is why I talk to y'all about cleaning your chair down, wiping underneath your tray, cleaning your area, washing your hands, donning your gloves, putting on your lab coat, buckling it up in the front or snapping it in the front, okay? This coronavirus has taught us that some of these viruses are very, very contagious, and we need to break this cycle of infection. We need to cut down on it. And washing our hands, wearing gloves, wiping down areas, wiping off our tray, making sure we change gloves when we go from patient to patient, constantly washing our hands. These are the things that help us prevent these viruses and bacteria from spreading, okay? So one of our think questions, what are 3 common tests that require the patient to be fasting prior to drawing the blood? This was in another one of our slides earlier we talked about. Okay, glucose, cholesterol, and triglycerides. Give the person sitting next to you directions for fasting. If you can, if you're at home, if you can give them to your child, if you give it to your spouse. If there's someone in your house, you can practice giving that person the directions they would have. If they come into your clinic or your facility, your doctor may rely on you to give that patient the information they need on what they need to do to be in a fasting state when they come back the next time to have their blood work done. You want to make sure that you tell them to refrain from eating and drinking except water for 8 to 12 hours. And you also want to make sure they understand no smoking, no chewing gum. And a lot of people think that they can drink coffee or tea as long as it doesn't have sugar in it. Nothing but water. Okay? Nothing but water. Sorry about that, guys. So I'm going to try to move in on this, see if we can get you a better picture so that you can pause that and then make sure you document it, okay? You need to be making sure that you can do these think questions, okay? Okay. So, labeling the veins in an arm, okay? It should be in your study guide. There's some stuff inside your book as well, but your study goods guide should have it. You're going to need to be able to label the veins in the arm, okay? You're going to label the veins in the arm, the cephalic, the basilic, the median, cubital, and the median. And you want to know, is this person in the correct anatomic position? Okay? So you want to be facing forward with your palms forward. And so this patient is. Okay? I'm going to go back to that real quick because I'm going to kind of try to go in just a little bit on that picture, hoping that y'all are going to get a much better image there. But if not, there is an image in your study guide. Okay? So we want to be able to do that. That will be on your test, okay? So you're going to want to be able to do that. Now, if you have any questions with this, you can email me now at any time on any of this. We also want to be able to label the veins in the hand. And again, look to your chapter. Look in your book. There's going to be photos in there as well of the veins in the arm, the veins in the hand, that it would be a much clearer picture than the one I have here on the screen. Okay? That's why I'm telling you guys that it's real important to do both to do your lectures online with the PowerPoint. and filling out your study guides, but also to look in your book. So in Chapter 10 on page 334, there is a picture of a hand, and it's labeled with the veins. There's also on page 335, there is a picture of an arm, and it has the posterior view, which is the view we would use to do the dorsal part of the hand if we were drawing blood there, and then it has the anterior view, which we would use to draw blood from the antecubital fossa of the arm. So please check out page 334 and 335 in your textbook, okay? So, and then labeling the dorsal veins in the hand. And again, like I said, go to your textbook for a bit of a better picture along with your study guides. Have those pictures in there as well, and you're going to need to know how to label this and where those veins are, okay? So Chapter 10 we finished up with. So now in summary, okay, in this chapter we learned about hand washing and how vitally important it is. And you guys have to know this right now, from watching your news, from what's going on with COVID-19, how important it is. It was important before COVID-19 came along, and it will definitely be important going forward from here. Also, patient identification. Make sure that you properly ID your patients before you draw their blood. And remember, we never label any tubes before we draw it. We draw our tubes, then we label them, okay? We talked about approaching and positioning our patients. We talked about how this is a customer service driven job. There's no job that isn't involved in customer service. You want to make sure you introduce yourself, ID your patient, make sure that they're comfortable and safe, make sure you communicate properly and respectfully with them. We talked about acceptable sites for sticking your patients. We talked about tourniquet tying and time specimens, order of draws. We talked about the wing infusion set, syringes, and vacutainer systems. So this wraps up Chapter 10. So now, as it stands now, you guys have your introduction video, video 1. You have Chapter 11, all in one, and then you have these several videos. Please watch them in order for Chapter 10. Now, read your chapters, fill out your study guides, and then start studying, okay? Now I'm going to go and work on Chapter 9, and I will get it up as well, and then I'm going to give y'all plenty of time to be able to watch these, fill out your study guides, read your chapters, and study. Okay, guys, have a great day.